Okay, I'm Dr. Rebecca Harris. I teach in the psychology department here, and I typically teach on social psychology and biological psychology. Okay, so my research has looked at loneliness for the last few years, and we've been examining the links between loneliness and health. And loneliness doesn't immediately seem like something that would result in people feeling poorly because they experience loneliness. But in fact, research has shown that people that are lonely, that have been lonely for a long, long time, actually have their life expectancy reduced, certainly in adulthood. It actually has an impact on our health and reduces our life expectancy in the same way as obesity would, and has certainly been shown to have a more significant impact on health than something like smoking. My main focus over the next couple of years is going to be looking at how children interact on social networking sites, and looking at how Facebook contributes to this link between loneliness and poor health, and how children might use the internet in a positive way to actually interact with other children if they're finding it difficult to connect with children in their kind of everyday lives. My research uses a mixed method approach to data collection. So sometimes certainly to measure loneliness, we give people questionnaires and they respond to how lonely they feel. So on one day I might be taking saliva samples off people to measure their stress response. On another day I might be wiring them up to a machine to measure their blood pressure. On another day I might be having a conversation with them to interview them. The mixed methods approach is quite exciting. So although we do have a bit of a reliance on questionnaires, I get the opportunity to measure, use objective measures like blood pressure and cardiovascular measurements. There's a number of ways that we use as lecturers here our experiences of research. Our teaching is research informed, so when we're teaching we can sometimes use examples of our research or other research that members of staff are doing in the department. And obviously we teach in areas that are close to our research areas. So I teach in social psychology and I teach in biological psychology. I'm really excited about research because at the end of the day what we're doing is finding out ways to help people that have real genuine problems that might impact not just on their kind of mental health but also on their physical health. I suppose if the result of the research I do results in people being able to break the cycle of loneliness and improve their health, then for me that means it's been completely worthwhile.